To check therapy results, normal diagnostics are possible in BioMed Hospital, such as MRI, CAT scan, X-ray, ultrasound, endoscopy. Also, we do have a large laboratory checking all the tumor markers one needs, the normal blood samples, and also what is very important in holistic oncology, there's a possibility to check the function of the immune system, such as killer cells, thymus helper cells, and others. Now, what are new therapy possibilities in BioMed Hospital? Surely there are possibilities for the patient to influence his cancer diseases by changing his lifestyle, by changing his food habits, by changing his life habits. We are teaching the patient for a healthy food which contains a large amount of fibers and smoothies and vegetables, by avoiding unhealthy parts of the food, such as saturated fatty acids or steaks or other things. Also, it's very important in changing the lifestyle to learn relaxing techniques such as silent training, such as relaxation according to Dr. Jackson, such as Reiki. Also, we do have 3 psychologists in the house where the patient can talk about psychic problems. Talking about psychic problems does not mean relieving the soul, but means that your immune system is going to function better. So this is very important to include it in the therapy result. Also, it's very important to start moving the patient. We know from statistics that a breast cancer patient who starts moving, who starts walking, who starts moving his body has a much better chance to survive the cancer disease than doing nothing. Also, for example, in large bowel cancer, when it's metastasized, also improves much more therapy results and the chances of survival when eating habits are being changed, when you stop eating saturated fatty acids in a large amount of meat. And third, lung cancer is a very dangerous and frequent disease in women and men. Unfortunately, climbing amounts in women, non-smoker. And in this disease, it's important to do an immunotherapy together with a chemotherapy, for example. Also, it's very important to stop smoking. So by changing your living habits to a more healthy life, you can do about 30 to 50% by your own to tackle the disease, to get the cancer into remission. Here in BioMed Hospital, we are trying to combine the useful parts of normal oncology, such as chemotherapy, such as radiation, with innovative or newer therapies, such as hyperthermia, we will see later. Also, to preserve quality of life, naturopathic therapies are added, such as lymph drainage, chiropractic, massage, inhalation of mistletoe and oxygen, and others. Before coming to BioMed Hospital, starting on a complementary treatment, we will contact your oncologist to be sure that the running therapy you do have with your oncologist can be continued in BioMed Hospital together with hyperthermia. And also, when you leave BioMed Hospital, a medical report will be given to you with recommendations for the oncologist at home. Also, if necessary, we will call him and discuss the therapies which had been done in BioMed Hospital. Also, we will discuss with him the outcome, the improvement of blood tests, the improvement of X-ray and other diagnostics. So it's very important that the therapy which is being performed in BioMed Hospital is, so to say, embedded in your further oncologic therapy at home. We will stay in contact by email and by phone to get your lab tests and to give more recommendations. Normally, after about 2 months, we recommend to return for a second treatment, for a second series of hyperthermia, together with the necessary oncologic therapy.